My name is Huang Wei Ling. I'm a medical doctor from Brazil. My first specialty is not neurology, I'm infectious disease doctor, but I have 5 more specialties. I'm general practice, specialist in nutrition, acupuncture and pain management, traditional Chinese medicine, and I'm working my own clinic in Brazil for the last 25 years, working with traditional Chinese medicine. So in my presentation today, I will present the team according to TCM point of view. Title: Energy Alterations in Patients with Parkinson-disease. And I also would like to thank the organizing committee to inviting me to this conference to share this study today. And also congratulate all the presenters from all over the world to be here to share their studies also. Parkinson's disease is a neurodegenerative disorder that mostly presents in later life with the slowing of movements such as bradykinesia and at least one other symptoms of resting. Other associated features are loss of smell, sleep dysfunction, mood disorders, constipation, and excessive periodic limb movement in the sleep. It's estimated that Parkinson's disease affects at least 1% of the population, and the disorder is associated with loss of dopaminergic neurons in the substantia nigra present in Lewy bodies. And most cases are idiopathic. Only about 10% of cases are seen in young people. And salivation is also often used to treat early disease and can provide mild symptom relief. And most anti-Parkinsonian medication provide good symptom control for 3 or 6 years, and disease progress and is often unresponsive to medication after this. And in general, younger patients should be treated more aggressively than older people. And in this presentation, I will be following Hippocrates' thoughts that said that foolish the doctor who despises the knowledge acquired by the ancient. For this reason, I will use the thoughts from traditional Chinese medicine that exists for more than 5,000 years to explain the symptoms in patients with Parkinson's disease. This is a tree metaphor that I usually use in my presentation to show the different viewpoints between Western and traditional Chinese medicine to you to understand which are the focus today to explain the Parkinson's disease according to TCM. This tree has a trunk with several branches. Each branch represents one medical specialty, and coming out of each branch, you can see many leaves, and this leaf represents one symptom and disease treated by each medical specialty. For example, if you have a headache, usually it's treated by a neurology specialty and in the leaf level. But and if you have knee pain, it's also treated by orthopedic in the leaf level. But what traditional Chinese medicine understands is that all leaf manifestation is not on the local. The problem is not at the leaf. The problem is usually at the root of this tree that Western medicine, yes, cannot understand because it's invisible by the naked eye, and in the root we cannot see. And traditional Chinese medicine understand that the human body also has the influence of the external pathogenic factors, such as the influence of wind, cold, heat, humidity, and dryness that is starting causing the beginning of the formation of the disease. And the first theory, there are 2 theories in this root that are yin and yang and the 5-element theory. And this disharmony between these 2 theories is the cause of manifestation in Parkinson's disease according to TCM that I will explain to you today. The first theory is the yin-yang theory, and this is the symbol that is representing. This is yin and this is yang. Yin is they are two forces that exist in all things in the universe, such as positive and negative, sun and moonlight and dark, heaven and earth, active and passive, fire and water, above and below, heat and cold, generation and growth. And all treatments nowadays aims to balance these two forces that are yin and yang. They need to be in the same height to the individual to have health, and all the treatments nowadays aim to balance this state. And when the patient has some energy imbalances between this yin and yang, there are the development of some disease. For example, when the patient has insufficiency compared to yang, the patient will have symptoms such as woman in menopause, such as hot flashes. And this is a situation where all diabetes patient has in the energy point of view is insufficiency with formation of internal heat, for example. And when you have yang deficiency, you have cold hands, cold feet, you can have liquid retention, urinary incontinence, prolapse of rectal and uterine, for example. And the disharmony between these energy will cause another energy disharmonies that I will show you. And yin and yang are two forces that are produced in the kidney, is the second chakra in Ayurvedic medicine, and the blood is produced by, and when there is these two energies to flow inside the body, there is the necessity of have two more energies that are blood and chi. And there is this energy balances between these four forces is the aim of all treatments. And if you treat all these four forces, you can treat all the patient's conditions at the same time, such as emotional or physical symptoms. And when there is a deficiency or a combination of deficiencies between these four forces, for example, when there is insufficiency and information of internal heat is a kind of fire, the patient could have the manifestation of other disease in the leaf level, such as diabetes. All diabetes type 1 and 2 has these energy deficiencies. And if you treat this deficiency and taking out this heat, for example, in diabetes patients, the patient, the glycemia will reduce, and it's very important to know this imbalance to treat their condition without using or reducing the use of medication or insulin. And when there is a combination of one deficiency or a combination of these four forces deficiencies, there is a formation of this internal fire that is responsible for many manifestations in the leaf level. And now, for example, all cancer patients have this energy deficiency pattern with formation of internal fire. And in this table, I'm showing that this is the 5-element theory, is the second theory in traditional Chinese medicine. In the root, the 5 elements corresponds to the wood, fire, earth, metal, and water. And all this is representing all the things that exist in our world, including inside the human body. And each element represents one internal massive organs. That wood represents the liver, fire represents the heart, the earth represents the spleen, the metal, the lung, and water, kidney. And different from the Western perspective, in traditional Chinese medicine, they understand that all the elements are interconnected by the energy flow. Here. Here is the 5-element theory that I want to show you, that is the water, wood, earth, fire, earth, and metal, and each element represents one internal massive organ in TCM, such as kidney, liver, heart, spleen, and lung. And they are interconnected by the energy flow, very different from Western perspective, that they understand that all organs are working independently and separately. And in this case, I'm showing that in Parkinson's disease, they are having symptoms in the leaf level. All symptoms in Parkinson's disease is in the leaf level, but what is causing these symptoms are in the root. The root is harmed. The energy of these internal organs is not working properly, and so they are the cause of all these manifestations. For example, when the patient has constipation, constipation in traditional Chinese medicine means blood deficiency. It's a deficiency of blood caused by this spleen energy disharmony, because the spleen is responsible for the absorption of nutrients and the formation of blood. And in TCM, one of the clinical manifestation of blood deficiency is when the patient do not have daily bowel movement. And if the patient do not have daily bowel movement, this means that the patient is having blood deficiency caused by the spleen and pancreas deficiency. And excess salivation is also caused by spleen and pancreas deficiency, caused by the wrong eating habits or excessive worry or alteration in the emotions. And the loss of smell, for example, is an imbalance of the lung, because the lung is responsible for the sense of smell in TCM, and the earth is responsible for the sense of taste. And this sleep dysfunction is caused by the disharmony in the heart meridian. The heart in TCM is responsible for the sleeping process, and the majority of disease that has sleeping dysfunction have heart disharmony, but in TCM, there are many other mechanisms of energy imbalances that can lead to sleep dysfunction. And the combination of these alterations here in the 5 elements could have led to this sleep dysfunction that I will show you in another research and in the clinical case that I will present now, that patients with Parkinson's disease has these disharmonies between these 5-element theory. And loss of smell, I told you, is the deficiency in energy of the lung. And tremors is another kind of alterations, very common in Parkinson's disease, that is caused by these energy deficiencies between these 5 elements that I will show you the reason. And this periodic limb movement in the sleep is another association, but the problem is not in the central nervous system in TCM, but is caused by the alteration in the 5 elements in the root of this tree. Here's to show you that all this reasoning began in 2006, that I treated one specific patient that I will briefly tell you his history to you to understand why I am focusing in the root of this tree and not explaining Parkinson in the leaf level only. And he was a 70-year-old male patient that came to my clinic because he was feeling leg pain for the last 6 months with no improvement, only with the use of anti-inflammatory medication. And his alterations in the root level was kidney iron deficiency. He has an alteration in the water element or kidney, And I began his treatment using Chinese dietary counseling, systemic and auricular acupuncture with apex blood dilating. And after 10 acupuncture sessions, he returned to my clinic and told me that his leg pain improved, but he also improved for another condition that I was not aware when I treated him. He was treating for glaucoma for the last 40 years with no improvement, only using eye drops. And for the first time of his life, his intraocular pressure reduced from 40 to 17. And during this treatment, he didn't tell me that he had glaucoma. And in this case, when I treated the root, as I show you, he had the symptoms of leg pain in this orthopedic specialty, but he also had another condition that was glaucoma in the ophthalmology specialty. But when I treat, but he had been treating the leg pain using anti-inflammatory medication with no improvement, because the problem is not the leaf. The problem was in the root that was still not treated. And when I treated the root in the energy disharmony, all the patient's conditions, such as physical, emotional symptoms, could improve it. Even the doctor does not know that the patient has such a symptoms. And in this presentation, I will show you one case report of a Parkinson disease to show you which are the energy alterations in these patients and how can we treat it. And he's a 70-year-old male patient who retired at age of 56. And he had the diagnosis of depression before the diagnosis of Parkinson's disease. And after 2 years suffering from depression, the doctor decided to send him to neurologist appointment. And at that consultation, the neurologist diagnosed him with Parkinson without performing any exams, because he was having tremors. He had tremors and the depression symptoms. And the family and friends were surprised and did not agree with the diagnosis of the patient. And only he was having tremors and depression symptoms. And his wife took him to my clinic, and he started to use the medication. I cannot remember the name of the medication that I told you in the beginning of my presentation. And he started to use 3 times a day the medication, and he was not improving with the medication used. And when he went to my clinic, I measure his chakras, energy centers. And chakras here are the energy forces that exist in our body that we cannot see by the naked eye, and is studied by Ayurvedic medicine. But there is a correlation between the chakras with the 5-element theory in traditional Chinese medicine, and that when I measure the chakras, energy centers using a crystal pendulum, through the radiesthesia procedure, I can see that in this patient, all his chakras, energy centers were in the lowest level of energy. The first chakra corresponds to the liver, the second chakra corresponds to the kidney, the third chakra corresponds to the heart, the fifth chakra corresponds to the lung, and the fifth chakra corresponds to the spleen, and the sixth chakra corresponds to the memory and concentration. It was in the lowest level. Only the spiritual chakra has the energy in the 7th chakra. This is the connection with God. And after this result, I started his treatment using alteration in the diet and using auricular acupuncture and replenishing these chakras and energy centers with high diluted medication. I will explain to you why I am using high diluted medication instead of high concentrated medication. And this is the Chinese dietary alterations that I needed to know. Chinese dietary counseling is studying the energy of each food to treat the energy alterations in each patient. And in this case, I orientate him to avoid the ingestion of dairy products, raw food, cold water, and sweets, because all this food can reduce the energy of the spleen, pancreas, meridian, that's the 50th chakra, responsible for the absorption of nutrients. And when the patient is not absorbing adequately the nutrients, all the energy that is supplying the other organs will be very weak, and that is why we need to orientate to do not eat this kind of food, to drink mainly lukewarm water, because lukewarm water can increase the energy of the spleen and pancreas, increasing the absorption of nutrients. And also avoid the ingestion of this food that can imbalance the wood element or the liver, and cause the formation of internal fire. And this is the main cause of the tremor symptoms in Parkinson disease, is the alterations in the energy deficiencies that is causing his depression symptoms. Because the depression in traditional Chinese medicine is caused by these energy deficiencies inside the internal 5 massive organs. And in TCM, they treat these energy deficiencies to improve the depression symptoms. And as this patient had depression symptoms and he was feeling fatigue and do not have energy to do anything, and that's the reason I measure his energy and prove that his symptoms came from these energy deficiencies and not caused by energy, neurotransmitters alterations in the central nervous system, as the Western medicine is telling us that the depression came from these energy neurotransmitters deficiencies. And when the patient usually ingests this kind of food that can increase the heat, this the internal fire, there is a formation of wind inside the body of this patient, and this wind is causing the tremor symptoms in Parkinson disease. And we can see that this tremor is very common nowadays in adolescent and young people due to this energy deficiency that is common in quite, not only in this patient, but the quite population in this world are having these energy deficiencies in all kinds of diagnoses that I will tell you. Research that I did in my clinic in Brazil showing that the majority of patients are having these energy deficiencies. And also I orientate him to avoid the ingestion of coffee, soda, mate tea, because all these drinks can reduce the kidney energy that is responsible for the production of yin and yang, very important to keep health of our patient. And beside the Chinese dietary counseling, I did the procedure of auricular acupuncture with apex bloodletting. And this is a very important procedure to treat Parkinson symptoms, because through this release of 2 or 5 drops of blood in the apex of the ear, I can release that fire that the patient is forming, that is causing the formation of internal wind, causing the tremor symptoms in Parkinson disease. And when I take this blood at the apex of the ear, I can reduce the fire inside the patient's body, and the tremor symptoms could reduce. And also I inserted the mustard seeds through the small adhesive tapes in the ear to treat the 5 elements disharmony. The 7, here is the kidney, here is the liver, here is the spleen, here is the heart and the lungs. And here is the shaman, is the common point to treat anxiety. Here's a point to treat anxiety, and treating these internal organs, the patient can improve the depression symptoms also. And this point is to regulate the insomnia and the sleeping process, disharmony. And also I did the systemic acupuncture. And here's to show you that his chakras or his internal massive organs were in the lowest level of energy. And when the patient has this pattern of energy, the patient can increase the production of internal fire inside the body that I told you. Every time that the patient has internal energy deficiency, there is a formation of internal fire leading to the formation of internal wind that is responsible for the tremor symptoms in the energy point of view. And I used to use homeopathy medication to treat this energy deficiency condition, because in China, when the patient has this energy deficiency inside each internal massive organ energy deficiency, they usually use Chinese herbs. But I have Chinese herbs to use in Brazil, but they are more difficult to find and more expensive for our population. And that's why in 2015, I began homeopathy course. And when I begin homeopathy course, I begin to write a new theory in homeopathy to link with traditional Chinese medicine, because nowadays homeopathy is a very good medication to be used in this new type of population, that this type of energy alteration is not in Parkinson-disease. I will show you that the majority of the disease nowadays has these energy alterations, leading to diverse disease in the leaf level. But what they have in common are these energy alterations, including patients with all infectious disease, patient with COVID-19, patient with diabetes, hypertension, myocardial infarction, patient with strokes. I will show you in many other articles. That's what is causing this energy deficiency state is the influence of the electromagnetic radiation that the whole globe, the whole population in the globe is suffering nowadays from the modernization of telecommunication due to the implementation of 4G and 5G technology, and leading to this energy deficiency state in quite the majority of the population, including babies that are born nowadays, are having these energy deficiencies. And to treat this deficiency, to treat the liver deficiency, I use phosphorus. To treat kidney deficiency, I use natrium muriaticum. To treat heart, I use sulfur. To treat lung, I use silicia. To treat spleen, calcária carbônica. And to treat the memory and concentration, you can see that the majority of patients that I'm studying nowadays also are having lack of memory and concentration. And only 80% of the population that I'm studying have the connection with God, the spiritual chakra, but the 20% do not have this chakra without energy also. And this is a research that I did in my clinic showing that I studied 1,000 patients in my clinic from 2015 to 2020. And you can see that this is the age between them, from babies, children, adolescents, young adults, and older patients. They are all having the same energy alterations that is no energy. 1 means no energy, and 8 is a normal energy between the liver, kidney, heart, lung, and spleen. They are all having these same energy alterations. And this is not happening only in my clinic in Brazil. I think this sample could be a sample of what is happening in the whole world nowadays. If you measure the energy of your patient, And including us, nowadays we are in this energy deficiency state, and this is a state of immune depression, and we are not immune competent anymore because of this influence of electromagnetic radiation. And after this treatment, the result of this patient, after this treatment, he improved very much from his depressed condition. He has more energy to do his daily activities, and his wife is very happy of his improvement, and they are trying to reduce his medication that he started to treat this Parkinson, because every time he used the medication, his symptom was worsening and not improving with the medication he was using. And the intention of the treatment in Parkinson is to replenish these internal 5 massive organs, to do not produce the internal fire, to do not produce the internal wind, and in this case, reducing the tremors and all the clinical manifestation of depression, of constipation due to normalizing the formation of blood, and the alteration in the smell due to lung deficiency. After you treat the lung, you can treat these alterations. And these are all alterations in Parkinson's disease is caused by these energy deficiencies in the 5 internal massive organs in the root of that tree. And this is another publication that I can show you, that patients with essential tremors also have these energy alterations in the root in the 5 internal massive organs. And in this article, I'm showing 4 case reports. All patients are having tremors due to, the first was an adolescent, was a young adult, 22 years. She was using a lot of medication to treat anxiety, depression, and panic syndrome. And using this kind of medication was reducing her vital energy even more and causing the formation of internal fire, internal wind. And that is why her treatment using the same tools explained in this case report was possible to reduce the tremor symptoms. But if we do not reduce the high concentrated medication that she was using to treat anxiety and depression, it was maintaining the cause of energy deficiency that was the intake of this high concentrated medication. And the second case report was adolescent or 16-year-old that was having tremors due to the use of so many computers and cell phones every day, reducing his energy and inducing the formation of internal fire and wind. And the third case report in this case was a 60-year-old man that he was using in his work the insecticides to treat reduce the mosquitoes and in the cities, to reduce the dengue transmission. And the absorption of this kind of products in his skin was reducing the vital energy that was already low and leading to the tremors manifestation. And also this patient also had implants in his knee, and all implants, metallic implants inside the body, can reduce this vital energy, leading to the formation of internal fire and wind, leading to tremors manifestations. And the last case report was a 72-year-old female patient that she had the beginning to have tremors after the implantation of dental prosthesis of titanium. And the use of this kind of prosthesis can lead to deficiency in the internal energy and leading to formation of internal fire, winds, and the formation of tremor symptoms. And in this article I published last year, I'm showing that the majority of the patients that are receiving COVID-19 vaccine are considered immunocompromised and not immunocompetent because of this energy deficiency. Energy means our immune system. And when our the energy is low, our immune system is very compromised. And nowadays we can see that there are many patients having the HIV-like symptoms, but they are having symptoms of immunocompromise, but they are not having HIV. And this probably is caused by this energy deficiency state. And there are so many articles that I published online showing that the majority of the disease have in the background, in the root of this tree, this same energy deficiency. And in this article is the population in the world, the same as in the past. I am showing that the population changed from 2015, from the in the past, because the energy of our population are very different from the energy of the population that we had in the past. In the past, the energy of the 5 internal massive organs was normal, but nowadays, if you measure the energy of your patient, you can see that they and not have any energy. And that is why we are facing so many clinical cases of myocardial infarction in young adults, could have post-vaccination or not, or cases of cancer or cases of diabetes and cancer in children, all is caused by this energy deficiency that is leading to manifestation of older patients in younger patients. And here in this article, I'm showing this result of this research, showing that this energy deficiency is leading to propensity to have COVID-19 infection. And here's another articles that I published this year. What do we need to know to prevent and control nosocomial infection? Here's to show you that the lack of knowledge in Western medicine about the energy alterations in all these patients, in the root and not considering the influence of the external pathogenic factors, is not controlling the hospital infection nowadays. And here's to show you that for patients that are having thrombosis in any part of the body, are having these energy alterations in the root of this tree, leading to thrombosis. Because when the patient, the majority of our patients are having this energy deficiency pattern. And when you use any kind of high concentrated medication, this energy will reduce. I will show you here. Is the Arndt-Schultz law, created in 1888 by 2 German researchers. And in this law, they are saying that the use of a high concentrated medication can reduce even more this vital energy. And the use of any kind of high concentrated medication can lead to complication. In this case, the formation of any kind of thrombosis in the lower limbs, or in the abdomen, or in the heart, in the coronary artery, or in the central nervous system, leading to strokes. And that is why I'm using all my patients nowadays only high diluted medication to increase this vital energy that is already low, caused by the influence of the electromagnetic radiation, and also the implantation of metallic implants and the use of high concentrated medication that is considered scientific after the Flexner report in 1910. But we need to understand that due to these energy alterations in the population nowadays, we need to change the type of medication that we are prescribing nowadays to high diluted medication, because the population changed their energy pattern. And all these articles that I'm showing here in this, here's to show you why homeopathy is the medication of choice in prevention and treatment of COVID-19 infection is because of this energy deficiency and the effect of any kind of high concentrated medication, reducing the energy of this population, and can lead to so many complications found in COVID-19 infection treatment, or leading to death. And here's another article, why homeopathy is medication of choice in the treatment of all kinds of disease. I'm explaining that due to these energy alterations in all kinds of patients nowadays, leading to formation of many other symptoms in the leaf level, are having the same problem in the root. The same problem in the root is the lack of energy in the 5 internal massive organs, leading to a diverse clinical manifestation in the leaf. And here's the theory that I wrote in homeopathy, linking with traditional Chinese medicine. You can search this theory. Is very important to us to know and to use nowadays, because we can treat all the patient's condition only using 5 homeopathy medication to prevent the formation of disease, any kind of infections or non-infectious disease, improving our vital energy, improving our energy, improving our immune system. And this is the medication. These 5 medication will be the medication that we will need to treat us and our patients, because we are all in this energy deficiency pattern nowadays. And here's to show you that homeopathy is a medication of choice in the elderly patients, because elderly patients also have these energy deficiencies, and that is why when we use any kind of high concentrated medication, we will harm even more this vital energy. And that is why use high diluted medication is the medication of choice to increase this vital energy. And using this kind of medication, we can rejuvenate these elderly patients. They will be more younger, and they are very happy nowadays because the hair became, that is white, became black. And they are very happy with this kind of treatment because they can have the more energy to do their activities that they are not having energy to do anything. And here's are some publications showing that all kinds of infection have in the background urinary tract infection, patients with recurrent urinary tract infections. All these infections are in the leaf level, but the cause is in the root also, and we need to treat the root to treat the symptoms in the leaf level. And patients with hemorrhoids, constipation also have these alpha energy alterations. And patients with psoriasis, patients with rheumatoid arthritis, patients with urinary incontinence, patients with dyspnea with mitral valve. In this article, I'm showing that it's not caused by this mitral valve stenosis, but the dyspnea symptom is caused by these energy deficiencies in the root. And that is why we can do wrong diagnosis, because in this article, I'm showing that even patients doing 2 or 3 surgeries for mitral valve, they are still having dyspnea. And that is why when we treat this energy deficiency condition, the patient improved and did not need to have surgery to replace the mitral valve stenosis. And in this article that I'm showing that what do we need to learn from COVID-19 pandemic, is that in this pandemic, all the alterations leading to symptoms in COVID-19 is caused by these energy deficiencies in the root level. And what Western medicine is not doing this diagnosis because they do not study these energy alterations. And that's why it's very important for us to begin to study this energy part, because we are formed by energy, and all the things that exist in the universe is made by energy also. And that is why if we do not study energy alterations, we will not do the right diagnosis in all kinds of treatments, because all came from these energy alterations in the root. And how can we prevent COVID-19 and other disease at the same time? And in this article, I'm showing that all disease came from the same root, that are the energy alterations in the root of that tree. And all these internal massive organs do not have energy. And when we treat this condition, we will prevent and treat all kinds of disease using the same method. And here is to show you that all clinical presentations and manifestation of COVID-19 is related to these alterations in the root and not caused by the virus itself, and caused by the type of medication that we are using to treat this condition. Because depending on the type, if high concentrated or highly diluted medication, the patient will have complication or will improve. Because if you reduce the energy of the patient, he will complicate and even lead to death. And here's to show you only that in Brazil, the acupuncture and homeopathy are considered both medical specialties since 1980 and 1995 by the Federal Medical Council in Brazil. I know that there are some countries in the world that they are not recognizing them as medical specialties, but they are very important tools to be used in all kinds of disease, in all kinds of patients, because we are facing patients that do not have energy, and depending on the type of medication that you are using to treat this new type of population, you can harm or not their energy. And that's why it's very important to us to begin to study the high diluted medication, homeopathy medication, and other tools to balance their energy, to improve their lives. And here's to show you that to understand in the deepest level what is happening in Parkinson's disease, we need to integrate both medicine, Western and traditional Chinese medicine. And the conclusion of this study is that the patient with Parkinson's disease, they have energy alterations in the internal 5 massive organs in TCM, and the treatment rebalancing and replenishing these organs will improve the Parkinson's symptoms, because all these alterations in Parkinson's are related to the internal energy deficiencies in the 5 internal massive organs. And the use of all these tools, the Chinese dietary counseling, auricular acupuncture with apex bloodletting, and replenishing these organs with high diluted medication, can improve or can cure patients with Parkinson's symptoms, and treat it in the energy level and not only just the symptoms. According to Hippocrates, it's more important to know which person has a disease than to know which disease the person has. We need to treat the patient and not the disease. If we treat the disease in the leaf level only, we will harm these alterations in the root. And that's why if we treat the root, all the patient's symptoms in the leaf level will be improved at the same time. Thank you for your attention. Sorry for the long presentation. If you have any question, I will be very happy to answer you. And here my email address. If you want to ask something, I will be very happy to reply to you. Thank you.